Dr. William Clark from the St George Private Hospital in Sydney, where I'm the Director of Interventional Radiology. So what we did with this review, myself and my colleague Terry Diamond, who's an endocrinologist, who did many of these early trials in Sydney prior to the vapor trial, was to reevaluate the trials that were considered in the Cochrane review, but through the prism of what was the evidence in and outside, within and without these trials, if you like, for patients that had early fractures of less than 3 weeks duration, which was the heart of the vapor trial, because 80% of the patients in our trial had fractures not more than 3 weeks duration. And we found a completely different set of conclusions to those drawn in the Cochrane review. In terms of what the readers can, learn from this paper, which may be clinically useful, there's a few things. One is that the best evidence is that in early fractures, less than 3 to 4 weeks in duration, causing severe pain, that vertebroplasty is an effective and safe therapy. The second thing is that unlike some of the past practices of vertebroplasty, if the patient has severe pain and an early fracture, there is a window of opportunity in which vertebroplasty will be effective. So it is important not to delay the procedure unnecessarily, but to activate an early MRI program and then early intervention program, because essentially the less that bone collapses and crumbles, the more effective the vertebroplasty will be. So in that regard, technically, the earlier the procedure is performed, the more likely you are to have an excellent clinical outcome. Another point would be for those of you who are not treating patients with early fractures, start, because this is the best group of patients to treat with vertebroplasty.